Hello, I'm Barbara Konkle from Bloodworks Northwest and the University of Washington in Seattle, Washington, and a co-investigator on the SB 525 study, the Alta study, which presented an update on the phase 1/2 gene therapy for severe hemophilia A. So this, the vector for that was studied in this trial is a AAV6 vector, which is liver specific and carrying a B domain deleted factor VIII gene that's delivered through a single IV infusion. This was a phase 1/2 trial, which enrolled males greater than or equal to 18 years of age with severe hemophilia. And they went through a screening process, and key exclusion criteria included a neutralizing activity at AAV6, a history of liver dysfunction, and a contraindication to steroids, as well as a history of hypersensitivity response to factor VIII replacement therapy. The study, the primary endpoint was the incidence of AEs and SAEs and change in circulating factor VIII activity. And secondary endpoints were change from baseline for factor VIII replacement therapy, change in frequency and severity of bleeding episodes, and measurement of factor VIII inhibitor levels, and also vector shedding. So it was an escalating trial, and most of the attention, although I'll mention a little of the others, was on cohort 4, which was 3 times 10 to the 13th vector genomes per kilogram. No corticosteroid treatment was initiated for ALT elevations that exceeded 1.5 times baseline. And follow-up duration at this point is between 1 to 3 years. In terms of safety summary, the most common AE was ALT elevation, and of the high-dose cohort, 4 of the 5 subjects. So in terms of safety, the most common AE was ALT elevation, which occurred in 5 participants and in 4 of the 5 participants who received the highest dose. Those individuals were started on corticosteroids, and all individuals were off corticosteroids by 26 weeks. One participant in cohort 4 had a treatment-related serious adverse event of hypotension and grade 2 fever and tachycardia about 6 hours after completion of infusion, which resolved with fluids within 12 hours of the infusion. At that time, the individuals were kept NPO during the infusion, and it's thought that dehydration probably contributed to that. So subsequently, hydration was given and no similar events occurred after that. There were no participants who developed factor VIII inhibitors. In terms of efficacy, in the cohort 4, there was, as has been shown before, a increase in factor VIII activity, really to within the normal range for all individuals. At 52 weeks, the median factor VIII activity was 56.9% in cohort 4. However, in the individuals who are followed after that, there has been a drop in factor VIII activity in all but one individual, but they have remained within the mild hemophilia range. So an overall summary, The interim data with at least 1 year and up to 3-year follow-up post-infusion showed that the vector was generally well tolerated. There was one SAE thought contributed to by dehydration. There were transaminitis, although all resolved by 26 weeks with corticosteroid therapy. There at week 52, there was median activity of over 50%. However, in cohort 4, however, of note, there were declining factor levels in all but one subject after that, although they have been maintained in the mild hemophilia range. And these data support ongoing study of this vector, which is being done in the AFFINE phase 3 study, which will have a dose of 3 times 10 to the 13 vector genomes per kilogram. And the first subject was dosed in October 2020. Thank you.